When manually exercising in the supine position, place a small pillow or rolled towel under the patient's knees. The assistant places one hand on the anterior thigh just above the knee and the more distal hand around the patient's ankle. The assistant will provide resistance with the proximal hand through the full range with mild stretch at the end. Use care that the limb returns under control. Do not allow the knee to snap. The assistant will be most effective by shifting the weight from the far leg to the near leg during resistance and back to the near leg for the beginning of the next repetition. The subject is positioned in a supine position on the back. Place a rolled towel or pad under the patient's knees. From a 90-degree angle, place the proximal hand under the knee and the distal hand under the patient's heel. Provide resistance with the distal hand, maintaining the subject's foot on the surface during hip extension. Prevent the knee from snapping by having the free hand under the knee. The assistant should shift the body weight from one leg to the other during the resistance and back to the starting position. The subject assumes a supine position with a rolled towel or small support placed under the knees. The assistant places the near hand on the lateral thigh above the knee to provide resistance. The distal hand will help guide the leg and prevent external rotation of the hip. Maintain the exercising leg quite close to the table. The proximal hand provides resistance as the assistant shifts their weight from the far leg to the near leg. Progress to active abduction on the side when capable. The subject assumes a supine position with a rolled towel or small support under the knees. The assistant places the resistance hand just above the knee and inside of the thigh. The distal hand helps to guide the leg and prevent medial or lateral hip rotation. Maintain the leg position close to the table. Begin the exercise from a leg spread abduction position with the assistant's body weight mostly on the outside leg. Provide manual resistance with steady hand pressure on the inside of the thigh. The assistant is transferring his or her body weight to the opposite leg during the resistance. Help the subject move the leg to the starting position and repeat the exercise. As capable, progress to active resistance on the side if not contraindicated. The subject is in a supine position on the back. Place a rolled towel or pad under the knees. The assistant places both hands as the resistance above and below the knee. Begin the program by assisting the subject in turning the exercising leg outward. Both hands offer resistance as the subject turns the leg inward. The subject and the assistant return the leg outward as far as possible and repeat the resistance movement. Progress to active seated or side-lying resistance when appropriate. The subject is exercising in a supine position on the back. Place a towel or pad under the knees. The assistant places one hand above and one hand below the knee. Begin the exercise from a complete internal rotation. The assistant will assist the subject to the starting position. Both hands offer resistance as the patient turns the leg outward, also providing mild stretch at the end of active movement. The subject and the assistant return the leg inward as far as possible and repeat the movement. Progress to an active seated or side-lying resistance when appropriate. The subject is placed in a side-lying position. Bend the non-exercising leg 90 degrees at the hip. The assistant should stand behind the subject, assist the movement of the top hip to 90 degrees of flexion. The assistant cradles the upper leg on the top of the forearm with the hand surrounding the knee. Place the free hand behind the top hip to help stabilize the pelvis. The subject will move the top thigh horizontally backwards as the assistant resists effort with the hand. Assist the leg to the starting position and repeat the movement. Progress to active resistive bent knee and straight leg hip hyperextension in a prone position as capable.